Hello everyone, Dr. Jason West coming at you with 102 years of healing. We're going to talk about depression because it's normal for people to go, kind of like this. We just want to make sure that you're not going like this. And you know what, for a lot of people, they're doing it to themselves on accident. They don't even know that they're doing it. Definitely there's a time and a place for anxiety medicines and depression medicines, but there's also a time and a place where it may not be needed. And that's what this video is about, how to take control of your health, how to remove barriers from healing, and how to achieve and maintain optimal health. Here it is. This video is about how to treat depression naturally, and we want to talk about what is depression, if you have depression, do you need a prescription, the natural treatments for depression, and after watching the video, we'll talk about the last 2 decades have witnessed a huge increase in depression diagnoses. At present, 1 in 10 Americans takes an antidepressant medication, and many of those individuals are taking multiple prescriptions to treat more than one psychiatric illness. Few people will even raise an eyebrow anymore about hearing about a friend or a family member being diagnosed with depression. And it's been my experience that most profound healing outcomes occur, not with pharmaceutical interventions, but with a holistic approach where you're talking about balancing the emotions, doing mind-body healing, putting the right building blocks in the body, and practicing forgiveness. Now, there's a whole bunch of different segments and offshoots of this video, but this talks about the natural methods to not only help curb symptoms of depression, but also to address the fundamental causes of the condition. And by consciously and deciding to make lifestyle choices that promote physical, mental, and emotional health, we can create a mind-body balance that allows us to access the more vital tools for preventing and reversing depression. It all starts with nutrition. Recent estimates are about that half people diagnosed as suffering from depression could obtain relief simply by having underlying physical disease identified and treated. See, when you don't feel good and you're in pain, it makes it easier to be depressed. And then are you depressed because you're in pain, or because you're having pain because you're depressed? It's a vicious cycle. And among the conditions I've discovered that will cause hormone fluctuations that will manifest as depressive or anxiety-causing symptoms, these include thyroid problems, malnutrition, pain problems, electromagnetic sensitivity problems, allergies, a lack of quality of sleep, a nutrient deficiency, or chronic unremittent stress. And there are many doctors that within the orthomolecular movement, which is the functional medicine world, who see things this way, and yet most people continue to go see a psychiatrist or psychologist right off the bat and get into the standard therapeutic models. Now, that's appropriate for some people, but I've seen a lot of people respond to taking control of their health by putting the right systems in the body or right processes in the body, and by managing their stress levels. I also have a great deal of concern with things like Prozac and Zoloft and Paxil, because I think they have a tendency to get overprescribed. They're really, really important when needed, but many times there's some other interventions that can really help people's health. What I like to try with depression and anxiety or cyclic mood disorders, or your ups and downs that are associated with blood sugar and nutritional fluctuations, is to try the least invasive approach first. And there have been studies that have shown that the natural derivatives of things like folic acid or methylfolate or GABA or glycosylphosphocholone to be effective as an antidepressant drug therapies, which they're being compared to. Now, this supports the claim that nutritional-oriented doctors, including naturopaths and functional medicine doctors, have been making for many years. Because folic acid, as prescribed in megadoses, appears to help people, glycosylphosphocholone or GPC or phosphatidylserine really helps people, and these are natural building blocks for the neurotransmitters and the nerve health. Another breakthrough is the amino acid tryptophan can be another key substance in the treatment of depression. Now, according to Dr. William Goldwag, tryptophan helps raise the levels of serotonin, a naturally occurring chemical in the brain that has been found to be abnormally low in depressed people. And we've learned about serotonin from experiments in which certain drugs that preserve it from being destroyed in the brain seem to work for some antidepressants. That's why they're called SSRIs, selective serotonin reuptake inhibitors. The theory is that whatever can supply or aid the serotonin factor will help depression. And some foods that contain tryptophan, like turkey, can act as antidepressants and it's found abundantly in milk as well. Now, tryptophan is a precursor to Prozac and other drugs like it, and the drugs that amplify the activity of serotonin in the brain. But tryptophan is a natural substance which the brain manufactures its own serotonin, and so it gives the brain its own building blocks to make the brain healthy. In controlled studies, it was found consistently to be as effective as antidepressant drugs that were available. Now, 5-HTP is another compound which is a little bit closer to serotonin. It seems to be even more effective than tryptophan. And while milk and turkey as well as kiwi fruit, figs, dates are good sources of tryptophan, there are plenty of foods that should be avoided. The first step in eating a brain-healthy diet is to eliminate fast foods, simple carbohydrates, cake, and one of the most common sins that we have is in the breakfast we take a piece of bread, we put fat on it and sugar on it, we turn it into cake, but it's really toast with jam. Be careful with that. It's also really important to avoid bagels in the morning because bagels actually can have as much sugar as soda pop. And so when people are running out the door and they get an orange juice and a bagel and a yogurt, they think they're eating healthy. It's like throwing in a big source of gasoline on a fire. It flares up, you get all this energy, then it dies down and you crash. So a diet to eliminate fast food, simple carbs, alcohol, artificial sweeteners, gluten, fried foods, white flour products, caffeine, and meat-based diet can really, really help. This is challenging. It's hard. You don't have to do it on every case. And in many cases, if you'll get your body on a proper sleep schedule, you'll get enough water into the system, what will happen is you can have a really nice stabilizing effect on your emotion. Now, to prevent and combat depression, your diet should contain lots of organic, non-GMO fruits and vegetables, brown rice, millet, beans, and essential fatty acids or protein. Placebo-controlled research conducted with medicated patients suggests that adding omega-3 fatty acids, particularly EPA, may ameliorate symptoms of major depressive disorder. Your nerves and your brains are fats. If we put the right fats in your system and improve the insulation, it improves brain health. At all costs, you need to avoid fried foods and fast food like hamburgers and French fries. These foods are high in saturated fats that block arteries and the small blood vessels, interfering with blood flow to the nerve structure. Your blood cells become sticky, they clump together, and you feel like you're always running a marathon. And it leads to poor cerebral circulation, brain fog, dementia, forgetfulness, and transient global amnesia. Depressed people that are attracted to sugar and caffeine because of the initial lift it provides, they're always looking for a crutch. Sugar does stimulate the serotonin levels, which in turn temporarily improves your mood, but this initial surge and then you have the crash. And the reason behind the initial boost is it's all quick energy. It's not sustainable energy. It does not have to be digested and it passes directly into the bloodstream where it dramatically raises the blood sugar, overstimulates the pancreas to produce too much insulin. The excessive insulin then causes the sugar levels to plummet, and within half an hour of consuming a sugary snack, your blood sugar levels will drop to very low levels, allowing the fatigue, the hyperirritability, the anxiety to creep in. And with people that have anxiety, usually there's some rebound melancholy or depression. And so if we normalize that teeter-totter and minimize it, it helps your overall emotional health. With these feelings present, the person seeks another boost from sugar, resulting in another vicious cycle. So if you start off your morning with sugar, you're usually getting sugar all throughout the day. Now, an increasing large body of evidence shows that junk food diet can exact a heavy toll on our emotional well-being. A long-term study appearing in the Journal of Public Health Nutrition in 2001 observed that people who commonly ate fast foods and processed foods were 51% more likely to suffer from depression than those who rarely or never indulged in these foods. The study's data reflected a dose-dependent relationship, meaning that more unhealthy staples one consumes, the more risk is for developing depression. These findings are consistent with the 2009 analysis by British researchers that produced a clear link between diet and depression. It was published in the British Journal of Psychiatry, and the study concluded that people who consumed a diet high in foods such as fried foods, processed meat, refined grain, and sweets were 58% more likely to experience depression compared to those who consumed a diet rich in fruits and vegetables. Now, the millennial-old practice of Tai Chi, which is a way to center the energy in your body, was shown to effectively combat major depression in seniors at a recent study of scientists at UCLA. And these findings were published in the American Journal of Geriatric Psychiatry, indicating that elderly patients diagnosed with the condition saw remarkable improvements after practicing a westernized version of the Chinese martial art. Again, movement is life, movement is important. The study compared the outcomes of the two groups of seniors receiving the standard depression treatment. One group engaged in 2 hours of Tai Chi classes weekly, while the other group spent the same amount of time attending health education class. Both groups realized the notable improvements, but the Tai Chi group experienced significantly better improvement in memory, cognition, and quality of life, and had reduced levels of depression. Speaking in the interview, the study's lead author, Dr. Helen Levetsky, remarked, "With Tai Chi, we may be able to treat these conditions without exposing patients to additional medications." Now, what all of that means really is if you take good care of yourself, if you go to bed consistently, you get the right stuff into your body, the right building blocks, avoid nutritional deficient foods like fast foods, it can really have an effect on depression. Managing your sugar levels are absolutely key. And so let's talk about some natural things that you can do for depression. So number one, essential fatty acids, 6,000 to 8,000 milligrams. I like Ultimate Omega from Nature's NX. There's a whole bunch of really good essential fatty acid products on the market. You want to make sure that your liver and your gallbladder is functioning really well, because that helps to emulsify the fats and get the building blocks for the insulation around the nerves in your body. And then managing sugar levels by eating consistently, eating proteins, eating fats, eating complex carbohydrates, and then supporting the pancreas. You can do that through a glandular approach. You can all do that through a product called Blood Sugar All-in-One. You can do that through spices like cinnamon. And if you eat small, consistent meals, you'll avoid the roller coaster impact that is really, really difficult on blood sugar levels, which causes anxiety and depression. And those are some treatment considerations. Management of depression naturally. I almost forgot, one of the most important things to do with emotional health, with physical health, is the ability to forgive. Now, forgive doesn't mean that you completely let go anything that anybody has done that is wrong. One of the best books I've ever read is Forgive for Love and Forgive for Good, Your Prescription to Health and Happiness. I would really encourage you to read the book. It's all about how to not let people get inside your inner circle or your inner dynamic or inner health and allow those emotions to throw off your karma, your chi, your id, or your ego. Wonderful book talking about how important that forgiveness is for your overall health and how it's so critical in your emotions. You should really check the book out. Forgive for Good and Forgive for Love. Hey, thanks for watching the video on how to treat depression naturally, some considerations for lifestyle modification, some natural things that may help you. Remember, we're across all platforms. We're always doing articles, blogs, and videos. If you perceive value, please like us and make sure that you click on the bell so you'll get a notification of every time we send out a video, because we really want to help you to get healthy and to live at your maximum potential. This is Dr. Jason West, and we'll see you tomorrow.